everybody? I believe you're doing fine. This is JEMIENAFTALY and the channel's name is The Pediatric World. I welcome you to my YouTube channel. It's only here, it's only in this platform whereby we talk, we learn, we want to discuss with the mothers, with the caregivers, the parents and everybody on the common illnesses that affect our children while growing up. And here we want to use a simple language. We want to be as layman as possible so that everybody is able to understand. If you're new here, I welcome you to this channel. So today's topic is on the continuation on the neonatal sepsis. Remember in our last episode, we were talking about these infections, the neonatal sepsis. And we are going now to see the treatment, the management, and some of the complications that these babies get. So, treatment and management of the neonatal sepsis. So, what we do is we start by doing the lab tests. We want to send for stool test. We want to send for the urine test, and also we want to do blood tests. So, with these tests, we are able to see how far the infections are. On top, we want to do something else we call cerebrospinal fluid analysis. This is when we are sensing that it could be meningitis. Remember, meningitis was one example of the neonatal sepsis. So we want to do the CSF analysis, that is cerebrospinal fluid analysis. We also want to do chest x-rays. Remember, we have issues with the breathing. We want to see exactly what is happening. We also want to do cranial ultrasound in case of, again, meningitis. Remember, the meningitis, the infection now has already reached the brain, inflammation of the meninges. So we want to do the cranial ultrasound. So those are some of the tests, and this is part of the treatment. This is part of the management of the neonatal sepsis. So now, supportive care. What supportive management do we give to these babies? We want to give this baby the oxygen. We want to support them by giving them oxygen, depending. Remember the difficulties in breathing. So we want to support them by giving oxygen. We also want to give IV fluids. It is part of the supportive care. Remember, and as we give the IV fluids, we want to monitor the intake and outtake, the intake, and also we want to see what the baby what comes out. So input output chart, we should monitor the input output chart while giving these IV fluids. We also want to provide a thermoneutral environment. Remember, we said temperature instability is another thing that affects these babies. It is what they present with. They can have hypothermia, low temperatures, and also they can have hyperthermia, high temperatures, depending. So we want to provide a thermoneutral environment. We want to keep these babies warm, and this is part of the supportive care. We want to feed these babies also, and this is again a supportive care to prevent many things. We want to do the routine care. Remember, when you were talking about the routine care, we did an episode on the cord care. And here we said that the cord is the center of infections for these babies, remember. So if it is not well taken care of, if it is not cleaned the way it should be, remember we were saying the inside-out position, the movement, not doing the round, not to introduce the infections to the cord, because this is the center of infection. This is where most babies, most neonates will get infections from. So cord care is another supportive care. Now, when we suspect neonatal sepsis, when you have the risk factors that we talked about and we suspect, treatment should be initiated immediately. Why? These neonates have low immunity. They are immune compromised. So we don't want to waste time. We want to start when we suspect the sepsis. We want to start a treatment in form of giving drugs. And what drugs do we give? We want to give antibiotics, and we want to cover for both gram-negative and gram-positive microorganisms. Remember, we said the microorganisms involved here are both gram-positive and gram-negative. So we have two types of antibiotics that we use. So one for the gram-positive of microorganisms and the one for gram-negative. So 2 types of antibiotics, and we give for a duration of 7 days. Yes, for a duration of 7 days, and it is in form of IV. It is IV through the vein. So these babies, these neonates, we want to have them. We want to admit them as we do this and as we monitor this. So this is the definitive management. We have the first line drugs, and we also have second line and third. But the first line drug really works wonder. And when do you know that these drugs are not working and you need to switch to second line? This is when, if after giving the first line drugs, we still have some spiking temperatures, the baby still has difficulties in breathing, for example. So if we still persist having these symptoms despite starting on these first line drugs, this is now that will tell us, and we are able now to switch to second line drugs. And again, each line has got 2 types of antibiotics. We said we want to combine to make sure that we treat for both gram-negative and gram-positive microorganisms. So this is it that happens. So we are saying the duration is for 7 days. If it is meningitis that is suspected, it is a bit stubborn. So for the meningitis, we use the same drugs, but the difference is we use higher drugs. We double the dose. We double the dose of these antibiotics, and we give for longer, not 7 days, but at least 14 days. So we want to start these antibiotics. We want to double the doses and also to give for a longer duration. So it is 14 days and we double the dose. Meningitis is a serious thing. It's a serious one. In meningitis, this is when now the infections reach the brain, and we have the inflammation of the meninges, and this can bring us to have a very serious complications. So that is why we want to be active. We want to really treat these babies before the complications come in, before this happens. So meningitis, that's how we treat. The same antibiotics, but we double the dose. We want also to give these antibiotics for longer, for 14 days. What are some of the complications of these neonatal sepsis? What do they complicate into? So number 1, they complicate into hypoglycemia again. Remember, we said it's a killer. It is when the blood sugars are low, so we should keep monitoring these sugar levels. And we said to prevent this, it's by feeding, and we have seen again it's a supportive care to these neonates. So hypoglycemia. Meningitis may also complicate into hydrocephalus. Hydrocephalus is when the head is large. It is large and very unproportional to the rest of the body. It's so big. What we do the head circumference, we measure. So we measure from the behind here, and we are able to see that the head is more big. It's larger compared to the other parts of the body. So this is hydrocephalus, and it is dangerous. We also want the meningitis also can complicate into things like brain abscess. Yes, brain abscess, very, very dangerous also. It can also complicate into CP, cerebral palsy again. Remember, we said cerebral palsy is a permanent thing. It is irreversible. It's not reversible. Once the baby gets that cerebral palsy, they will have to live with that condition. And it's not easy. It's not easy raising a CP child. So we should really, and you see it is coming from these infections, and we can really avoid them. Cerebral palsy, a permanent thing. So very, very serious. So this is it. We have now known, it was a short one. Now we know how to treat the neonatal sepsis. We know what antibiotics we give, why we do it, and we have seen also the complications of this neonatal sepsis. So guys, it is this serious, and thank you for staying with me. If you haven't subscribed, please keep on subscribing. Hit on that subscription button. Subscribe, like, share, and leave a comment below. And also hit on the notification bell so that you are able to know whenever I post a new video. Thank you very much.